Welcome back to my channel. Today I'm going to be answering questions and responding to comments on autism and virtual autism. Ready? Let's get started. The first comment I'd like to address is the following. My daughter is 1 year, 10 months old and has all the signs of autism. I eliminated screen time completely almost 10 days ago, focused on communication. I take her out to play now almost every day. I keep on talking and trying to communicate with her all the time by describing everything we are doing, even the simplest things. I also try to push her to communicate by pointing at things, not giving her what she wants before saying, "Give me," each time with the hand movement. And oh my goodness, unbelievable differences. I recommend to all parents to remove screen time or restrict the time that their kids are exposed to screens as much as possible, particularly if they have a developmental disorder and are on the spectrum. When you remove screen time, regardless if your child was born with autism or developed virtual autism, removing screen time will help significantly. This mother saw an improvement within less than a month. You will see similar milestones because the young developing brain does not fully develop until age 25. Particularly below age 10, they are very plastic and the brains can change and grow and develop significantly. So therefore, if you remove or reduce screen time, you will improve the development of your child. If you're confused about what I'm talking about in regards to virtual autism, screen time, you should watch this video here where I explain to you what virtual autism is and what screen time can do to the brain of a developing child. The next comment is, many medical professionals do not believe this is possible. I think it's inappropriate for any doctor to diagnose a child with autism without taking their environment into account, particularly excessive screen time, which is impossible. They always just watch behaviors. This video needs to go viral. I agree, I wish my videos go viral too, but you know, it's not very popular. Over the years of working with parents and working with my wife in this realm, I discovered that parents don't want to hear that their children aren't doing well, that their children are struggling, and that in particular, they may be at fault for their children not developing properly. So therefore, if we can help one child at a time, that is good enough for me. And so that's why I made this YouTube channel, that I can communicate this out rather than trying to travel to school, and to community to lecture. I used to do that a lot, but now I don't. I'd rather stay at home in my home studio and shoot videos and get this message out. So please, if you are passionate about this topic, to like, share, comment, and subscribe. That helps the algorithm on YouTube to share the videos more. And also send my videos to your friends and colleagues so that they can understand this concept of virtual autism and also video game addiction. The next question is, can a diagnosis at age 3 of autism spectrum disorder have false diagnosis even if it's virtual autism? Diagnostic tools for autism is based on behaviors and looking at specific behaviors in children. So the tools are very good. They're about 90 to 95% accurate. So it's unlikely that there will be a misdiagnosis. Now, virtual autism looks identical or similar to regular biological autism that's present at birth. So therefore, the same tools that diagnose autism will also be used to recognize virtual autism. When we remove screens from an autistic child, the autistic child who was born with autism will do better. The developmental trajectory will change and that child will improve. However, in a virtually autistic child that was induced by excessive screen time, once screen time is removed from that child, the trajectory is incredible. I've seen these children who are virtually autistic improve in a matter of 6 months. I've seen children at age 2 diagnosed with severe autism improve to the point where they were normal at 6 months. And then at 6 months, the diagnosing doctor would say, oh, it was a mistake, it was a misdiagnosis. But remember, these tools that we're using are 90 to 95% accurate. So misdiagnosis is very unlikely, even though it can happen. This question is a little longer. My child was diagnosed at 3 years in the category of mild to moderate autism. He had all the milestones until the age of 22 to 23 months. Then he regressed, stopped babbling and calling mama and baba, and very less eye contact. I went for occupational therapy at age 2.5 and used multivitamins to whatever that was recommended. I searched and discussed with his pediatrician. He later learned the alphabet, puzzles, animals, colors, and many things. Then I added the speech therapy and home tutor with almost 0 screens. It worked well for the last 5 months. Now his speech has developed. He reads books for single words, alphabets with sounds, sings poems, and knows many daily routines. But he does not perform well in social communication, and he is obsessed with animals these days, whether in the form of toys or any picture of them. I don't know how to measure his progress and find whether I am on the right path or not, and what else can I do for him further to save him. I feel so helpless. He is turning 4 next month. Can you guide me further or recommend any person for this? I would be grateful. I would say this parent is doing all the right things. She's hooking into speech therapy, pediatricians, and other occupational therapists. And so I would say maintain the course. Now he has regressed a little bit, but that's okay. Keep the screens away, continue the eye-to-eye contact, continue the communication with the child, continue face-to-face interactions and human interactions with this child. They will do wonderfully and continue to have a positive trajectory. So maintain the course. You're doing fantastic. The next question relates to Wi-Fi radiation. Where do you think wireless radiation fits into all of this? Have you ever advised to turn off Wi-Fi in the house? I'm a young adult who has tried these interventions on myself. I've done several screen fasts and turn off Wi-Fi and room circuit breakers at night. I also use only incandescent bulbs and sleep under an EMF canopy. I've seen great results from all the intervention together. Thanks for sharing this knowledge. We live in an environment full of electronics. My laptop has EMF, the lights, the electrical wiring in the home. We have extremely low frequency EMF as well as high frequency EMF. So low frequency EMF is like the electrical frequencies in the electrical wiring in the home that runs at 50 to 60 hertz or cycles per second. Wi-Fi typically runs at 2.4 to 5 gigahertz. So these are high frequency EMF. Now there's very little things you can do to block the high frequency EMF. You can just turn off like this one individual where at night you just turn off the router or turn off the Wi-Fi in the home. For low frequency EMFs that run in 50 to 60 hertz, which is the main electrical EMF, watch this video here on earthing and grounding HEALH. You can use an EMF meter like this to detect EMF in the home. And so I use this meter to detect where I have the highest levels of EMF, which is radiation, essentially, caused by electromagnetic frequencies that can insert that frequency onto the body and cause problems. So in extremely low frequency EMF, like 50 to 60 hertz EMF, we can actually see an induced alternating current onto the body. So again, this video here explains that so that you don't think I'm completely crazy, and I actually talk about the science and I discuss 13 peer-reviewed papers surrounding this area of EMF radiation and human health. Well, thank you so much for joining me. If you have any questions, please post them below. Make sure you like, share, and subscribe to my channel so that you don't miss future videos on how to improve your health. Thank you very much. Have a wonderful day.